After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify the patient using 2 identifiers.
Good morning, Mr. Wilson. I'm Jennifer. I'm going to be your nurse today. Can I check your armband, please? Your name?
Ben Wilson.
And your birthday?
7/6/51.
Thank you.
Assess the patient's tolerance for bathing and activity, comfort level, cognitive ability, and musculoskeletal function. Determine whether the patient has shortness of breath. Before or during the bath, assess the condition of the patient's skin.
We're going to get started on your bath. Do you need to void at this time? All right.
Encourage the patient to void prior to beginning the bath. Arrange your supplies on the overbed table. Raise the bed to a comfortable working height. Lower the rail on your side and help the patient into a supine position on the same side of the bed. Drape a bath blanket over him and ask him to hold the top edge of it as you remove the top sheet beneath it.
Thank you.
Place the soiled sheet in the linen bag.
All right, I'm going to put the side rail down and we're going to take your gown off on the left side.
Remove the patient's gown or pajamas. If he has an intravenous line, an injury, or reduced mobility on one side, begin from the unaffected side.
Put the side rail up and then we'll go around to the other side.
Then remove the gown from the other side.
Put this right side rail down now. And slide your arm out of the gown, please. Thank you for your help.
Pause the fluid infusion by pressing the sensor on the IV pump. Take the container off the pole and slip it and the tubing through the arm of the gown. Then rehang the container and restart the fluid infusion. If fluids are infusing by gravity, check the flow rate and adjust it if necessary. Do not disconnect the IV tubing to remove the gown.
Thank you.
Raise the side rails and lower the bed. Fill the wash basin 2/3 full of warm water and have the patient test the water temperature to make sure he can tolerate it. You may warm a bottle of body lotion in the water. Remove the patient's pillow if the patient's condition allows and raise the head of the bed to 30 to 45 degrees.
You can rest your head back down.
Place one towel under the patient's head and another over his chest. To protect his eyes, ask him if he's wearing contact lenses.
Mr. Wilson, do you wear contact lenses?
No, I don't.
Okay.
Then begin the bath by immersing the washcloth in the basin. Wring it out thoroughly. Fold the washcloth to form a mitt and wash the patient's eyes with plain, warm water, bathing the eye from the inner to the outer canthus and using a new section of the cloth for each eye. Soak any eyelid crusts for 2 to 3 minutes, if necessary, before you try to remove them. Be sure to dry gently and thoroughly around the eyes. Next, ask the patient if he'd like you to use soap on his face.
Would you like soap to be used on your face, sir?
Then wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears. Ask a male patient if he'd like to be shaved.
Would you like me to shave you today, sir?
No.
Okay. I'm going to start with your arm then.
If the patient is unconscious, wash the eyes with plain warm water, bathing the eye from the inner to the outer canthus, using a new section of the cloth for each eye. If prescribed, instill eye drops or ointment. If she has no blink reflex, keep her eyelids closed. Gently close each lid with the back of your fingertip before placing an eye patch or shield. Never tape the eyelid itself.
All
Now remove the bath blanket from the patient's arm that is closer to you. Place the bath towel lengthwise beneath the arm. Bathe the arm with water and minimal soap, using long, firm strokes. Move in a distal to proximal direction, that is from the fingers to the axilla. Then wash, rinse, and dry the entire arm. Wash the hands and nails. If the hands and nails need to be soaked, fold a bath towel in half and lay it on the bedside next to the patient. Set the wash basin on the towel and immerse the patient's hand. Let them soak for 3 to 5 minutes and then clean beneath the nails. Move the basin out of the way and rinse and dry the hand well. With the patient's arm raised and gently supported over his head, thoroughly wash, rinse, and dry the axilla. If needed, apply deodorant to the underarm. Standing at the other side of the bed, lower the rail, place the towel beneath the patient's other arm, and follow the same steps to wash that arm, as well as the axilla, hand, and nails. Cover the patient's chest with a bath towel and fold the bath blanket down to the umbilicus. Then bathe the chest again using long, firm strokes. With a female patient, take special care to clean the skin beneath the breasts. Lifting each breast with the back of your hand. Rinse and dry the area well. Check the water temperature now and change it if necessary. Otherwise, continue by washing the abdomen. Drape 1 or 2 bath towels lengthwise over the patient's chest and abdomen, folding the bath blanket down to just above the pubic region. Keeping the abdomen covered as you work, wash and rinse the abdomen under the towel, paying close attention to the umbilicus and surrounding skin folds. Dry the area and help the patient put on a clean gown or pajama top. If you prefer to finish giving the bath before you help the patient dress, continue washing the lower extremities, covering the patient's chest and abdomen with the top of the bath blanket.
We're going to move to your leg.
Then expose one leg by folding the blanket toward the midline, while keeping the perineum covered. Arrange the towel lengthwise under the leg. Now wash the leg using long, firm strokes from the ankle to the knee, and then from the knee to the thigh. As you work, assess for signs of redness, swelling, and pain. Thoroughly rinse and dry the leg. Next, wash the patient's foot, cleaning carefully between the toes. Clean and file the nails as needed, according to agency policy. Rinse and dry the toes and foot completely. Soaking the patient's feet in warm water for 10 minutes can help maintain cleanliness of the toenails and feet. But never soak the feet of a patient with diabetes or any other patient with impaired sensation. Apply a little moisturizing lotion to the feet. Remove the towel. Raise the side rail. Move to the other side of the bed. Lower the rail and follow the same steps to wash the other leg and foot. Discard towels into the linen bag. Then cover the patient with the bath blanket. While the patient is supine, provide perineal care as needed. For details, see the video skills on performing male and female perineal care. After raising the side rail, change the bath water. With fresh bath water in the basin, apply a clean pair of gloves. Lower the side rail and help the patient into a prone or side-lying position.
The pillow. And then I'm going to put the head down. Just let me know when it's comfortable for you.
Place a clean towel lengthwise along his side or back. If fecal material is present, enclose it in a fold of underpad or toilet tissue and clean the area with disposable wipes. Keep the patient draped by sliding the bath blanket over his shoulders and thighs. Working from the neck to the buttocks, wash, rinse, and dry his back using long, firm strokes. Cleanse the buttocks and anus, moving from front to back and paying special attention to the folds in that area. Then rinse and dry the area and replace the absorbent pad if necessary. If the patient's skin is intact, remove your gloves and give the patient a back massage if he'd like one. For details, watch the video skill on performing a back massage. If not, apply body lotion or moisturizer as needed. When you're finished, drape the patient with the bath blanket.
Okay, sir, I'm going to help roll you on your back now, okay? So we can get a fresh gown. Finish up this bath.
For some patients, a commercial bag bath or cleansing pack can provide a quick cleanup. First, warm the product in a microwave according to the package directions. Each cleansing pack contains 8 to 10 pre-moistened towels. Use a new pre-moistened towel for each general area of the body. Follow the same order of cleansing as for a total or partial bed bath. Excessive soiling may require an additional cleansing pack or a conventional washcloth, soap, and towel. When you're finished, lightly drape the patient with a bath blanket and allow the skin to air dry for 30 seconds.
All right, sir, I'm going to put a clean gown on you.
Then dress the patient in a clean gown or pajamas, beginning with the affected side, if he opted not to dress earlier. Help the patient with his grooming and comb his hair. Be aware that a female patient might want to apply makeup. Check the function and position of external devices, such as indwelling catheters, nasogastric tubes, IV lines, and braces. Place the call light within the patient's reach and arrange any personal belongings. Place the bed in the locked, low position with at least 2 but no more than 3 side rails raised. Clean and replace bathing equipment. Remove your gloves and perform hand hygiene. As part of your follow-up care, record the procedure, including how much the patient participated and how he tolerated the bath. Document the condition of his skin and any findings, such as reddened areas, bruises, nevi, and joint or muscle pain. Report significant findings to the nurse in charge or to the healthcare provider.